Number 10. New skin rash. Cutaneous eruption. A visible lesion or a group of lesions on the skin due to trauma, agents, medications, allergies. Or they can be warning signs of serious illness such as autoimmune disease, such as psoriasis, contagious illness, such as ringworm, or cancers, such as melanoma. Skin conditions can change rapidly with time. For example, a 24-hour rash can give no symptoms, for example, from an insect bite. A 48-hour rash can mean a life-threatening cellulitis. A 72-hour rash can mean amputation. And a 96-hour rash can equal death. While most rashes in children are most commonly allergies and are benign, allergies can be life-threatening. So always have rashes, especially new skin rashes, evaluated by your pediatrician. Number 9, pale skin. Pale skin in children is generally missed in parents. Paleness can be a normal seasonal change. For example, in winter, our skin tends to lighten up. Paleness and fair skin are very different. Pale is when the skin becomes unusually lighter than normal complexion and color, resulting in an abnormal color change in skin and mucous membranes. In children, pale skin most commonly is indicative of anemia, low red blood cell count, low iron, and hemoglobin. But it could also be dehydration, frostbite, low oxygen levels such as hypoxia, anxiety, blocked blood vessels, and even shock, which is a life-threatening emergency. So while most cases of pale skin are normal and benign, if it appears suddenly or with other symptoms, call your pediatrician. Number 8, repeated vomiting. Cyclic vomiting syndrome, or recurrent severe vomiting in episodes without cause, can be serious illness in children. It could be indigestion, food intolerance, infections such as viral or bacterial gastroenteritis, digestive difficulties such as Crohn's disease, irritable bowel syndrome, bowel obstruction such as intussusception, nervous system issues, hormone imbalance. So seek medical attention for vomiting, because vomiting can lead to dehydration and malnutrition, which basically is when the child cannot get adequate nutrition to sustain life. Number 7, the child will not smile. Children smile for 2 reasons: when they are happy and when they are excited. They have not yet mastered the fake smile or the smile on cue as adults or older children. Thus, their lack of smiling generally can be inferred as they are not happy and they are not excited. But it could be also a serious reason for them not smiling, such as autism. They could be in pain and they may not be able to, they don't feel good. They are not necessarily able to communicate those things, so they just don't smile. So when you notice maybe your child hasn't smiled for a whole day, see your pediatrician and have that evaluated. Number 6, poor eye contact. The majority of information we receive is processed through our vision. Thus, we communicate first and a lot through our visual center. Poor eye contact can lead to very serious illness in children. It could be fear, as if someone has done something to them and they are making poor eye contact with that person or with the parents. They can dislike what they're looking at. There could be a hearing problem, so they do not hear you, so they obviously don't look up and know that you are speaking. There could be social anxiety and shyness. There could be children that are now showing signs of autism. They can be in pain. For example, most children don't make good eye contact when they have an ear infection. This is not to be confused with cultural norms, such as Asian children are not necessarily taught to make eye contact, whereas Americans, we are taught that when you speak with someone, you make and maintain full eye contact. Number 5, the child does not recognize their parents. Most infants recognize their parents before other family members and friends. Mom is generally recognized first just because of them being in the womb, knowing the mom's voice, her heartbeat, and her smell, and the fact that children are generally more so with their mom, a lot more than they are with their fathers. That is why it is encouraged that fathers talk to their children through the womb so that they can be familiar with their voices. However, kids have very poor or blurry vision as infants. Generally around 2 weeks to 4 months, though, their vision clears up and they're able to recognize their faces more of their parents. If at any time, especially after 4 months, it seems that they're not responding to your face or they're not tracking your face or following your face, it is very important to have that evaluated by a pediatrician. Number 4, decreased activity level. Children are very active. So activity decreases as we get older. So when you notice that, for example, you may notice that your child doesn't want to play on your phone or on the iPad or certain devices or watch television like they usually do and engage in those types of activities, and there's some type of decrease or irritability or frustration with these devices or doing things of that nature, there may be some cognitive problems going on. So it's important to have that evaluated. On the flip side of that, you may also notice that there is a decrease in physical activity, where the child isn't as active as other children or isn't active physically as they used to. You may notice that they sit down and get tired more and have to take breaks more. This physical decrease can be an issue with the cardiovascular or heart problems, where they're not getting enough blood pumped, or they may have breathing problems. It would be a respiratory problem. This is very important, it's very serious, and it needs to be evaluated by their pediatrician. Number 3, will not eat nor drink. This is not talking about the picky eater or the terrible twos. This is where children are hungry and they do want to eat, but unfortunately they are refusing to eat. This can be due to sensory problems. They don't like the way the food looks. They don't like the way the food feels in their mouth. Something sensory, the way that it smells, and is keeping them from eating. There could be oral motor skills, where you may notice that you put food in the kid's mouth or they put something in their mouth and then it appears that they're pushing it out with their tongue. It's not that they're not trying to eat. Their mouth or motor skills in the mouth are not able to manipulate the food to keep it in the mouth and to make it so that it's able to be swallowed, so they're refusing to eat. There could be pain with chewing, so they will refuse to eat. There could be medical issues such as acid reflux or something lower down in the abdominal area that is causing pain when they try to eat. Because they can't tell you what is going on or even recognize it's pain, they just refuse to do that activity. Number 2, does not urinate or have wet diapers. Infants should have at least 6 wet diapers a day, preferably 8 to 9 diapers per day should be wet. So when you have 6 or less, that tells us that there's possibly 2 things going on here. Either they're not getting enough fluids to make these diapers wet adequately, or maybe they are getting enough hydration, however the water is not being filtered or produced as it should be. So maybe there is some blockage that is going on for the urinary retention. So it needs to be evaluated, or they're dehydrated. Please have them evaluated for serious conditions by their pediatrician. Number 1, change in behavior. Change in behavior could be good or bad. For example, you may have a child who is a little rambunctious and a little on the high activity side, and you want them to calm down a bit, but you see that, wow, they just calm down, and you know, they're all of a sudden relaxed. Maybe they're sleeping more, they're just calm and quiet, and that's not your child. So that's something that looks good, but you know that's a big change in behavior without cause. On the flip side of that, you may have a child that's very calm and very easygoing, and you notice they have a change in behavior where they seem to be using foul language, they may be getting more aggressive. Both of these are changes in behavior and need to be evaluated for conditions that may have some type of activity that is doing abnormal things in the brain. This is a summary of the 10 signs of serious illness. You will see on 2 of them. There are videos that I also have that I would also love for you to check out. This next slide is a slide of the American Academy of Pediatrics contact information. They have a website, healthychildren.org. Check it out and see if it can answer any questions you may have. As always, thanks for watching. Click the subscribe, like, and bell buttons. Comment, and please share the video.